My name is Adam Brown. I'm a physiotherapist at Cornerstone Physiotherapy, and I'm one of the co-founders of Cornerstone. Metabolic health is at the center of many chronic diseases that the population suffer from. When we're thinking about things like hypertension, fatty liver disease, prediabetes, type 2 diabetes, high triglycerides, high cholesterol, polycystic ovarian syndrome. These conditions all have metabolic dysfunction as a common element. I think that the biggest gaps, and the one that this program aims to address, is that people are given advice. They're told to exercise more and to improve their diet. Then they go home and they try and fit that advice into the context of their life. And that's where the challenge is. It becomes very difficult to take general advice like that and apply it to an individual in a meaningful way. Our team consists of physiotherapists, dietitians, and OTs. These individuals complement one another and can bring expertise from their specific area, but also communicate with one another to get a unified strategy for that individual. Cornerstone's program is personalized to each person. That's the power of the program. So many things impact our metabolic health and our likelihood of developing chronic disease. Consider for a moment an individual who exercises plenty, eats fairly well, but has a high-stress job and doesn't sleep well. That person needs a totally different approach from the next patient who might enter the program, who sleeps great, feels they have stress under control, but doesn't have a background in nutrition or isn't comfortable going into the gym and feeling like they belong. When a patient enters the program, they undergo a comprehensive assessment of their metabolic health. Their physiotherapist will select team members based on the findings of that assessment. And then that person will have an appointment every 2 weeks with some member of their team, depending on what our early focus or what the focus is for that person's treatment plan. A metabolic rehab program is not a weight loss program. Oftentimes, weight loss is a consequence of improved metabolic health, but it's not the end goal. It's amazing the impact it has on people's lives when they begin to see changes that they feel are sustainable. It changes their lives. Ultimately, their ability to move through the world and to feel good on a daily basis improves. How they feel about whether or not they're going to be around for their children and grandchildren improves. So if you've tried to improve your health and found it difficult, if you have any of the diagnoses that we've talked about and you're motivated to make a change, give us a call, get an assessment done, and we'll be able to share with you where we think we should start.